seeing this increase in the abuse of prescription medications, and there's probably 3 or 4 different reasons why. First of all, that these medications are perceived as safe. That's probably the biggest myth that we need to shatter in this whole thing, is that because they are FDA approved and my doctor prescribed them for me, that they are safe. And in fact, yes, they are safe when used for the appropriate indication, with the appropriate supervision, and within the appropriate dose. Once you, again, start throwing into a fishbowl with a bunch of other things that you're taking handfuls of and washing it down with alcohol, that's really not, we're never going to be able to get a randomized controlled, placebo-controlled trial to look at the safety of that particular use. They're not considered illegal. Okay, that's a myth, at least, specifically within New York State, but kids today, if they get caught with marijuana or cocaine or even alcohol, if that gets on their record, they just blow their chance to get into an Ivy League school. Okay, but if they're walking around with prescriptions for Sonata or Zolpidem or antihypertensives or pain meds, technically they're thinking it's not illegal and it's not going to get them in as much trouble. They are readily available, and in fact, they are readily available. You can go to almost anybody's medicine cabinet today and open it up and find a number of prescription medications. People do not get rid of prescription medications for a couple of reasons. First of all, because they probably paid a lot for them. Okay, so if you pay $40, $60 copay for a prescription medication, I don't care what you tell me, I'm not throwing it away because I might need that again. And I don't have another $60, so I'm going to keep it around. Or I'm going to share it with my friends because that's what we do. It's like I'm going to keep it around because somebody else might need it. If it's an antibiotic, I'm going to keep it around because this way I'm going to save myself both a visit to the physician and another copay if I only take half of my antibiotic and save the rest for later. So there's a number of economic and logistical reasons why people don't throw them away. We have, in my opinion as a pharmacist, done a bit of a disservice by promoting the use of mail order prescriptions, because instead of just having a 30-day supply of a medication that you may or may not take and you may or may not finish, now you've got a 90-day supply that you will most likely not finish. 2/3 of prescriptions that are written by healthcare professionals are not taken the way that we think they are. 1/3 are actually never filled, and 1/3 are not filled the way, are not actually completed and taken the way that we as the healthcare providers want them to be. So that means, probably 1/3 of the prescriptions that are filled in mail order, which are 90-day supplies, are sitting around with nobody really kind of paying attention to them, nobody really supervising their use. And eventually, if you were to take, 3 or 4 or 5 tablets of a 30-day supply of medication, that's going to get noticed. Okay, you take 5 or 6, even 10 tablets out of a 90-day supply, you're probably not going to notice. And at the end of 90 days, I mean, seriously, we're dealing with, I can barely remember what I had for breakfast yesterday, let alone when I got a prescription filled, refilled, and how many did I really take. And yeah, I guess I could have finished all that, I don't know. And so it's one of those things that's where these supplies are coming from. I spoke a little bit earlier about the various motivations for use. That again, sometimes it's not necessarily to get high, sometimes it's to maintain a level of performance that we're looking for in our children today. So we go to the source. Let's ask the teenagers who have been surveyed, who said that they actually do use prescription drugs that were prescribed for them, and said, why? If you're using Vicodin or Oxycontin or Oxycodone from a friend, why are you doing it? Well, first of all, it's easy to get. Okay, I don't need to show ID. You don't just have to spend money for it. Or if I do have to spend money for it, it's usually cheaper than trying to get somebody to buy me alcohol or getting cocaine or anything like that. Again, they're available. The perception is that they're not illegal. Some of them actually get it via prescription. Okay, if you fall and you break a joint or you break a bone, you're not walking out of that ED with a prescription for Tylenol or ibuprofen. You're walking out with a prescription for Percocet or Vicodin or Tylenol with codeine. Again, we've done a very good job of making sure that prescribers today treat pain, but sometimes we have to kind of retrain our prescribers to say you don't necessarily need to give them a 30-day supply. Okay, this is going to be for an acute management of an acute pain, an acute symptom, try 7 days, and if they want to refill, then they have to come back and see you, and you can then give them a refill, and you can and keep better control over that situation. But in healthcare today, that's very, very difficult. So they are easy to get. They get them via prescription, and it is very, very easy to become addicted to things like Vicodin. There's probably nobody in this room who doesn't know somebody who's been addicted to Vicodin. Whether or not you've known they've been addicted is the question. I have friends who are directors of pharmacy, clinical pharmacists, doctoral trained pharmacists across the country who, through really no fault of their own, had a surgical procedure, had a back problem, and they found themselves in the middle of an addiction crisis. And sometimes I think it's even harder when you see it happening to yourself or to somebody who's close to you like that, who, again, this is not somebody who would fit this picture in your head of somebody who abuses drugs. They can claim a prescription if they get caught. So those are all things that we've spoken about already. So let's hit some of those myths. Obviously, the non-medical use of prescription medications are not safe. I pretty much hit on this one already. And the more you combine drugs, the more you have a risk of an adverse reaction, or you have a risk of a drug-drug interaction. And there are significant drug-drug interactions that we call black box warnings that can cause relatively quick and severe side effects. And there are also relatively benign drug-drug interactions that over the course of time can actually have a significant increase in the way a drug is metabolized, the way a drug is excreted. The combination of drugs can do significantly more damage to your kidneys or to your liver than a single drug alone. And throw some chronic use on that, throw some alcohol use on top of that, and you're actually doing some significant damage to your liver or to your kidneys. So it's not safe, and it's something that we have to make sure that we let our children know, that we let our parents know. Because sometimes there was actually, in some of the surveys that they did, they actually were talking with parents and said, well, would you rather have your child abuse Vicodin or abuse marijuana or hash or cocaine? And the parents said, well, at least the Vicodin, it's safe. I know it's not been cut with lye. I know it's, so even in their minds, it was safer than a drug that was bought off the street. I think that we've done some really good education as a healthcare society, and we're kind of debunking that myth. But it's still out there. So oxycodone addiction, and these are very interesting. Oxycodone has a street value of $1 a milligram. Okay. Now these come in 40 and 80 milligram tablets. So if you can score an 80 milligram tablet of oxycodone, that's a good find. Okay, and that's going to set you back $80. And what they do is it's either crushed and snorted, or it's actually liquefied and injected. And that high that you get with abusing oxycodone in this way is the same high that you get from heroin. Okay, but again, heroin, if you think about it, heroin has these really nasty connotations to it. You think of it's dark rooms, it's these people, the homeless people. You have this kind of picture in your head of what a heroin addict would like. Okay, but nobody can really sustain an $80 a pop addiction. And so if you get the same high from a $10 dose of heroin that you do from an 80 milligram dose or an $80 dose of oxycodone, eventually, financially and economically, eventually you're going to resort to heroin use. And that has been the thing that we see specifically on Long Island. I don't have the specific stats for Staten Island, but they are relatively the same. But that is what is responsible for the skyrocketing use of heroin in Long Island. So heroin is actually dropped in price, okay, because of volume and demand. So you can actually get a really, really, really cheap high with heroin, and you're feeding your oxycodone addiction. So a bundle of heroin priced at $150 in 2006, you can now get for $80, and you can buy them for up to, or as low as $7 a hit, if you will, on Long Island.